This patient has the mutation it's a point mutation in exon 18 actually, the G719 mutation. And again, this mutation, although uncommon, does result in sensitivity to afatinib. That's the drug that specifically has been studied in this uncommon mutation as well as other uncommon point mutations. There was a recent retrospective analysis of several large randomized and actually non-randomized trials. So there were several trials of afatinib that at the time included these uncommon EGFR mutations, whereas other trials did not include these uncommon mutations. Several afatinib trials did include them. So the authors of this retrospective study were able to go back to those prospective trials and retrospectively look at the data from the uncommon mutations. And they found that 32 patients had these uncommon mutations, and they were able to see how they did with afatinib. And impressively, they found that the outcomes were very similar to patients who have the common mutations, who have what we're used to seeing, the exon 19 deletions and the LA58R point mutations. But with these uncommon mutations, such as the one this patient has, the data look very similar. So the response rate was in the high 70s, the progression-free survival was around 10 months, and overall survival was around 19 months. So again, the data look very similar with these uncommon mutations as with the common mutations, which I think fully supports the use of afatinib with these uncommon mutations. What we don't know is what about the other EGFR inhibitors. Those have not been nearly as well studied with these uncommon mutations because these mutations were not included in those trials. So we really just don't know about their effectiveness with these mutations. Most other trials really just included the common mutations. So potentially they could work, we just really don't know as much about them. So I think that afatinib is a very good option for this patient, and we now have very good data showing that it does sensitize the tumor to afatinib. Again, we just know a lot less about the other drugs with this and other uncommon mutations. Potentially they could work, potentially osimertinib could be effective as well. Again, it's just because the trials excluded those mutations, we just don't know as much. So I think afatinib is a very reasonable option for this patient. And that's what was started for her. There are some uncommon EGFR mutations that make the tumor not sensitive to EGFR inhibitors. And that includes afatinib or really any of the other first or second generation EGFR inhibitors. And those mutations include the de novo T790M mutation. T790M is typically something that arises after treatment with EGFR inhibitors, but occasionally we can see it at baseline, at diagnosis. So that would be one situation where we've seen in this retrospective study I was describing earlier, we've seen those patients don't typically benefit from afatinib treatment. Also, the EGFR exon 20 insertion mutations, those tumors also tend to not respond very well to afatinib, or in the instance where they do respond, the duration of response or the progression-free survival is fairly short. We also learned that from the retrospective analysis of the afatinib trials. So those two instances, the de novo T790M and the exon 20 insertion mutations in EGFR, although those are EGFR mutations, those don't tend to respond well to afatinib, and so I would not use the drug in those patients.